good morning once again. My name is Martin. Teacher, I work with UWASNET, and I'll be moderating this webinar today. But of course, I want to take this opportunity to first of all appreciate you for making time to participate in the same. So with us, we have experts on the subject matter that will be speaking to us about the market-based sanitation implementation approach. And just to mention them, we have a gentleman called Dennis Alioni as an expert on this year. We also have a gentleman from the Ministry of Water and Environment, a senior public health professional called Martin Mujari. So those two will be speaking to us, but then at a later stage, we shall also be having other colleagues that will be sharing with us some experiences on this subject matter. So before we start, I just want to request us, because of the time, which is not our best ally now, I would like to request us to register our names in the chat window, but also as we progress, if you have any question, any clarity that you want to seek, kindly feel free to also use the chat window to post your question there. But otherwise, today we're going to be talking, dissecting and discussing market-based sanitation implementation approach. I know that we have had and implemented so many other approaches regarding shifting our sanitation sphere as a country from where we are, but of course with a focus on SDG 6.2, since we are committed as a country to meeting that. And of course, this subject matter will be certainly responding to some of the questions, but also promoting this approach, because apparently it is believed that it is the same approach that is going to help us, of course, have magic around shifting from where we are to access to basic and improved sanitation. We would like to also, again, recognize the support of Sanitation and Hygiene Fund, that's SHF, but also do acknowledge the support from Water for People that are the primary recipient of this fund that is helping us to pass on this knowledge, but also to scale up this concept of market-based sanitation implementation approach. Friends, as we speak, we only remained with 6 years to Agenda 2030. And where we are, when we look at the statistics of the country, certainly it's not impressive in any way. But of course, we know that as the different actors in this space, of course, with the leadership from the government and different MDLs, we have tried to make sure that this situation is improved, and by 2030, we are able to hit the target that we committed before the SDG agenda. So with me, allow me invite now our speaker who's going to come in first to talk to us and to try to dissect the complexities around market-based sanitation implementation approach. And that is none other than Dennis Alioni, who is a WASH expert, but also an expert in BCR. Dennis, kindly come in and speak to us.
Hey, we can't hear Dennis. Dennis, we can't hear you.
Yes, I think Dennis is having a technical challenge, but he's trying to address that. Dennis, can you hear us? If you could just type.
Maybe he can just restart his computer and then join again.
Yeah, he's trying to do that. Friends, please bear with us. This is the set of direction that we've taken as a country, but also as a world. Lessons from COVID-19, and we're still learning. These challenges do happen to us all. So let's kindly have your indulgence on this as we allow them to rejoin. And like I mentioned, friends, Dennis will be speaking to us before we get into the policy alignment of market-based sanitation implementation approach, where we shall have someone from the Ministry of Water and Environment, also a public health specialist, to talk to us about the same. Dennis will be breaking down the different terms and sharing with us the very examples that we believe will work to have this market-based implementation approach, scaled up. Of course, one of the things that we want to see is now looking at the customer as not only a consumer, but as someone who's able to invest in this sanitation space. And of course, own this as an individual, whether at household level, because that is the very way where we believe we should be able to meet the targets of SDG 6.2 targets before the 2030. But of course, be able to identify the different opportunities along the sanitation value chain that the private sectors herein, the CSOs, and the different players can be able to tap into. So Dennis will be coming in certainly with those examples of how we can basically tap into the same. I know Dennis is back here. Dennis, are you now able to speak?
Okay.
Okay, just checking. Can you hear me now?
Yes, Dennis, we can hear you.
Okay, thank you very much. I think let me share my screen. It says the host has disabled attendees from sharing their screens.
It's now enabled.
It's enabled, okay. Please confirm that you can view my screen.
Not yet.
Not yet.
Something different.
How about there?
Yes, we can see it now.
Okay.
It's okay then. You can go ahead.
Okay. Great, man. Like I was saying, thank you very much for inviting me. And thank you, Martin, for putting this together. Thanks to Water for People for funding this under the flagship Sanitation for Hygiene Fund. So good morning, everyone. So my task today is to talk to you about what market-based sanitation is like. I know that the brief was to have something that is specific to market-based sanitation implementation approach, but I think that because I only see that as an approach, and I would like to focus a lot more on the wider aspect and principles of what market-based sanitation is like. So the other iterations, the Finnish mondials, the MBSIs, the hygiene improvement projects that we had, all those are just iterations of what market-based sanitation is like. So I would like to focus more general on that. So in this presentation, I'm going to try and provide a bit of background, some justification, how the market is like in Uganda. But now when we zone down to market-based sanitation, what are the key drivers and things like that? And what are some of the interventions that different agencies can employ? They can be tailored to suit what exactly you want to do, but so long as the principles of market-based sanitation are there, then it suffices. And then I will give in a little bit of actions and roles, and then provide any resource that is required in that. So diving straight into sanitation, in Uganda, we are oscillating between 78, 79 to 80% of sanitation coverage. However, this is coverage that takes all the sanitation regardless of the ladder at which that household is. But that is erroneous. I would like people to shift more into now capturing sanitation based mostly on the ladders. So that gives us a good understanding of where we are for unimproved and all that. But in all this, when we come to what we have under, safe and basic sanitation, we are still lagging way, way, way behind. So we have a big way to go, first of all, from moving people from open defecation to, unimproved, to improved, to limited, to, until we get to the safely managed bit. When we look at this 60 to 70 and 67% of the unimproved, I'm focusing on that because it gives us a much easier step to get onto what basic and basic sanitation and safely managed sanitation is, where I think the country should be focused. So when we look at that, the Joint Monitoring Program classifies our country as being in limited progress. Limited progress meaning we have really stagnated, or we have had a very, very slow or snail pace achievement to the targets that we have set out in our Vision 2030 and then 2040. The targets that we have are really not the best. Currently, we are moving at a trajectory of a 0.4% improvement in access to improved sanitation, which if we are looking at our target, when you look at the red line, the dotted red line, at this trend, we will achieve our target in 2085. That we wouldn't want to do that. But if we can be able to, kick in other approaches and processes and resources and all that, we can be able to push and make sure that maybe if we come to an improvement of 2% per year, then I think by next year, 2025, we should be able to hit our targets for improved sanitation. So this was something that we did for the Millennium Development Goals, but it has not changed when it comes to still the SDGs, because we are still moving at that same trajectory. And that's why we are being classified by the WHO and UNICEF as under the Joint Monitoring Program as having limited progress. So what are the things that are getting us to this limited process, and how do we need to accelerate? We need a sort of a sanitation jump. I usually use the analogy of the snail. People do not, we are moving at a snail pace. People usually do not believe that a snail can fly, but I believe that in the processes and adapting market-based approaches, we literally can move from where we are right now down the ladder to the topmost. And making the snail jump is making sure that we put in place the right things, making sure that sanitation is, I usually use the word sexy, meaning sanitation is a push, not a pull. Usually, to get someone to construct a toilet in their community, there is concerted effort of, the health inspectors, the sanitation promoters, NGOs and that. But we want to use sanitation marketing to get people to actually be attracted to the point of saying, I want a toilet, but I want this type of toilet. And there are many things that we need to do, looking at what issues like, can they get the point of prioritizing? Can we look at the cultural beliefs? Can we give them different alternatives that can get them into the best part possible? So that sanitation jump, we need it. And why do we need it? Because we have evolved, we have used approaches that have really not given us the best out of that. Previously, starting with, for instance, enforcement in the 1970s and so, I'm told Uganda had one of the highest sanitation coverage in Africa, and that was because of the Public Health Act and enforcement. But when we come, that did not last. When the wars came in, we got depleted, we went back to zero, and then we developed other approaches like the pastoral hygiene and sanitation transformation. Then we came to the home improvement campaigns. I still see some people still have these home improvement campaigns as their approaches. And then from that, we evolved to community-led total sanitation approach, which still has some gaps in it, especially when it comes to the quality of the toilet, when it comes to behavior change, and when it comes to guiding people on, what prescribing exactly what it needs to be done. I know in development work, we're always told to try and look at the lens, to look at this through the lens of the community persons. But when the lens of the community person is dirty, it's our opportunity, it's our mandate to be able to clean that so that they can see. So CLTS does not, prescribe. It says use local materials. And what does this lead us to? The traditional toilets that after a rainy season, we go back to zero. So this has evolved into sanitation marketing, and we have had different initiatives that have attempted to do something on sanitation marketing. I wouldn't say it has been, some of it might have been bits and pieces. You've heard of people, organizations training masons and believing that this is sanitation marketing, others do this. But these are the examples of some that have evolved. We had the hygiene improvement project by Plan Uganda in Tororo. We had the scaling up rural sanitation markets project under the defunct water and sanitation project of the World Bank. It was in 4 districts: Amuria, Katakwi, Mitiana, and Mubende. So some of the learnings that we got from there went into what Water for People implemented under the sanitation as a business. And now we have had different other iterations of sanitation marketing, such as the Finnish Mondial, and then the market-based sanitation implementation approach in this. Not to preempt this slide, it's about the policies, and I know Mujabi is going to handle that, but we already have a bit of policies that can give us a kickstart. In relation to the gaps and everything, that can be looked at later, but at least we have a good policy regime that reflects. And when you look at the one in the middle here, the ISH, the ISH has been able to highlight, the 3 pillars under which we should be able to implement. And these are what market-based sanitation is all about: demand creation, supply chain, and then the enabling environment. So Mujabi will go deeper into discussing that. So I will skip over this because I highlighted part of it, showing how slow we are moving and what needs to be done. For the previous processes they have been looking at, for instance, CLTS, once we are done with open defecation free declaring a village, we have not instituted different things to make us see that we really need to continue. Much as open defecation is eliminated, now we need to go to the quality. So this speaks to what I've already talked about. So the next thing will be about highlighting what potential we have in the sanitation market. These tables here came from a study that was carried out under the Bureau of Statistics, highlighting at that point where we are and where we need to move and the potential that we have in there. We can see that the topmost, which is the improved basic toilets, are still low, whether it is national, whether it's rural or urban. If you look at the table on the left, the national coverage here gives us 20% only, maybe 18.7, that's 19% of coverage. We still have 20 and 51 20 who are limited, and then 51 who are unimproved, that still shows that we have a very, very big portion and movement we need to make. The one on the right gives us a little bit of breakdown on how the different regions are doing. But I implore you that when you're doing implementing any sanitation market approach in any place, the first thing that you need to do is do a bit of research to understand where we are for all the households mapped on the sanitation ladder, so that we can know where to put more emphasis on this. So this is a highlight on where we do. So in doing that, you need to understand your audiences. Yeah, in the market research, much as we're looking at them, it's not a one size fits all for everyone. What, for instance, Charlotte in rural Bukomansimbi thinks is not what Dennis in rural Arua or Robert in Ngora or Joseph in Kabarore are thinking. So this is a table that came through one of the studies that we carried out in the previous project that informed some of our implementation. So your market, your initial market research or understanding of the community of the market that we are serving should be based on some of these things. For instance, you can see Charlotte doesn't consider, open defecation normal, whereas Dennis here is considering it is normal. So that shows you something that you need to, much as the communication and the promotion to Charlotte is, taking them now from where they are right now, where they see that I own a toilet, it's a prestige to own the toilet. Now, how do you make the toilet more enjoyable? Borrowing from our marketing world, we need to make sure that people appreciate the product that they're buying, and then they have it, not the likes of where we are pushing them and then they're constructing a toilet. It's there, it's for your records, it's captured in the data, but it's not being used. So it does not serve the purpose for which it is. So understanding your market is one of the key things, and you must go into the nitty-gritties of what they think, what they feel, what they are doing, and what they ought to be done. So that helps us to be able to build our models to be able to do that. This is still an example of how the different populations along were structured. So I would like to say that when we're talking about a market, we do not look at a one size fits all. Every person is different, is unique. They want something because of the different things that are informing them, because of their mental frame. So we had this where we dissected and segmented the entire country to different. So when you see section E, there is a certain attribute to them. So the way you talk to people in segment E is not the same way you're talking to people in segment K. So market-based sanitation is not a one size fits all. It has to be tailored to a specific region, specific person, so that we can sell to them and give them what they really want. So that is what the market research builds and gives you, gets you to do. So that is what we need to be able to do with our market research. So you can see that this is where we placed all the different people. You can see that they're in different segments. So please make sure that is done in your segmentation. So this slide still goes ahead to give us a bit of what the current situation is. When someone in the village, in the rural area wants to construct a toilet, what do they go through? We need to understand that. Why? Because people want things to be made easy for them. In behavior change, we usually say, much as we're being direct and telling someone to maybe defecate in a toilet, defecate in an improved toilet, we need to make it easy for them to defecate in that improved toilet. So understanding the supply chain in market-based sanitation is crucial so that we can shorten and limit the burden for everyone. So this is a typical scenario of what someone in the urban area goes through to get a toilet and what someone in the rural area goes through to get a toilet. So if you understand this, then you can be able to tailor your market-based interventions to see that you make it easy for these people to do what, to get to where we want them to go. So that is a crucial thing in market-based sanitation. So when we talk about market-based sanitation, what is this? What is all this market-based sanitation or sanitation marketing about? It was really popularized a lot, much as a lot of work was done before, tits and bits. Jacqueline Devine and Coolman, who were part of the water and sanitation program, really went deeper in trying to conceptualize what sanitation marketing is. And this is the definition that they gave. Application of best social and commercial marketing practices to change behavior and to scale up the demand and supply of improved sanitation, particularly among the poor. So at that point, that was the understanding and the definition. But moving forward for purposes of, tailoring it to what we are doing and where we want to go, we can use this working definition of saying that a sanitation marketing is where a household makes full monetary contribution towards purchase, contribution, upgrade, and maintenance of a toilet from a private sector provider. Why is this key to say that they make a full monetary contribution? In a market, we don't do subsidies. In a market, we don't do, whatever we do sometimes we do this development work where we, for instance, want people to construct a toilet, then we go and precast slabs for them and we go and distribute. And then this is not what they want. I remember doing some work in the refugee settlements in West Nile, and there was an agency, I visited a casting yard where an agency had casted dome-shaped slabs. And trust me, all the slabs were free, but they were left in the casting yards because they did not understand what the people in those refugee settlements wanted and what they wanted to spend their money on. So if we don't get that right, then our market is not going to work because we expect them to pay. And when you expect someone to pay, they must pay for something that they love, that they want, that it's not more of something that they need. I know in sanitation and in the development world, we usually say people need to defecate in the toilet, but ask yourself, do they want to defecate in that particular toilet that you're pushing to them? No, they want to defecate in a toilet that they feel like they want. So understanding your market must be there. Private sector, we cannot do this alone. The government, we have done this in the development world, we have done this with the government, and mind you, the government doesn't do business. So we need the private sector to come in so that they provide the markets with what they want. What is the reason for private sector? Private sector, once they are shown where the profits are, they are going to do everything possible to make sure that they deliver. So let's go with that working definition. So this is a framework of what a sanitation market is like. We have the customer or the client on one side, and then we have the entrepreneur on the other side. We do not look at a client as a beneficiary. We look at them as a client, as a customer, because you're selling to them something, and that something needs to resonate with what they want. To get this market going, we need to target the market. We need to give them a product that they want. We need to give them a product system. We need to give them a delivery model, and then employ sales and marketing to see that it does. So, like I said, if we look at a client as a household as a client and a customer, and then the entrepreneur, so we need to marry those two and move away from the thinking of them as beneficiaries. But this market has drivers and barriers. So in our segmentation and in our market research, we need to identify, these are some of those. For instance, when it comes to what are the drivers and barriers for a client, you can see that the red dots are what the barriers are, and barriers are some things that inhibit, but drivers are something that enables us to do something. So unwillingness or inability to obtain financing, preference for ideal solutions. This is what I just explained on us in the development world, casting slabs and taking them and thinking people will want. But we know that people want prestige and they want something. So that's a biggest driver of markets in Uganda. Entrepreneurs, what is there? There have been, supply chains have been distorted. The government is not supporting in improving the enabling environment. Those are some of the barriers. But the biggest driver for private people and entrepreneurs is if you show them the profit, they will get it done. Enterprise still, do we have the appropriate products? Do we design them with the customer in mind? Do we give them what they want? So that is what we need to refer to, and all those things. So the business environment, we know that the supply chains have been poorly penetrated, but thank God that we have private sector people like Lixo that are supporting us with sato pans and, you know, products that, and they have worked with Nice House of Plastics to see that there are these products are moving from the manufacturing right here in Uganda to reduce the costs, and then using the supply chain of Nice House of Plastics to get these issues there. So in a sanitation market, all these must be taken care of. So what are some of the intervention themes that we can do? I've talked about the need to develop best fit products. That means talk to the clients, use human-centered designing in all this to ask them, what do they want? What do they prefer? And then how can we be able to use our product systems to give them what they can, what they want, what they prefer, but also at an affordable rate. So that key issues and barriers like unwillingness to pay, not having suitable products, we deal with those barriers and have them handled. We need to activate demand. I talked about this in the earlier sessions of knowing which market and knowing what message to give, which specific market. There are areas in this country where when you talk about pride, it sells a lot. You know, when you talk about prestige in some places, it sells. When you talk, so we usually do not look at things like disease. If you don't use a toilet, if you don't wash your hands, you're going to suffer from the disease. Someone will tell you, I'm 65 years old, but I have not had the toilet in my entire life, and I'm still alive. So in knowing the audiences, we need to tailor and activate demand and give appropriate messages so that our messages are looking at preference. Yes, you told us this is what you wanted and this is what you're giving you, and this is the benefit beyond just defecation, benefits like prestige, benefits like durability, benefits like privacy. This is what you're achieving out of the money that you're spending. We need to facilitate a network delivery model. After understanding all this, how is this network going to work? The actors, the banks, the trained masons, the transporters, all those, we need to look at them. And when we facilitate that delivery model, it gets this product to the last mile. An effective delivery model makes the business viable for the private sector so that they can have high returns on the investment. And then the other one is, the last one is making sure that we support people. I talked to you about making it easy for people to practice the behaviors or to construct this toilet. So one of the things is looking at wash financing. How are we looking at both the local mechanisms of financing sanitation and how it can be done? So we need to look at that, explore avenues using the VSLs, using the circles, using the microfinances and all those things. So I know some banks have started doing these wash loans, and thanks to water.org, the likes of Post Bank did this, Opportunity Bank and all that. So you need to explore. If someone cannot save, if someone is an agriculturist, they don't have money now, but they have seasonal crops that are coming up, how do you link up to make sure that they get the product they want right now and pay later, and giving all them those? So we're doing that. We make sure that we handle the things of inadequate savings, but also help them with the willingness and the ability to be able to pay for all these. So all those. I've talked about the best fit product, where you're balancing preferences with affordability. Since because of time, I wouldn't go in detail in all this, but this is an example of a project that had different best fit products, from talking to clients and understanding what they want, and then they provide them with what really they need. So those products, we need them. I have talked about the activating demand, making sure that we have the systems of talking to these people where they are, find them where they are, and give them and walk with them through the process of them acquiring these products that we are promoting. Creating a network delivery model, of course, to address the bottlenecks, but also to make sure that the entrepreneurs are running effectively and they are running cheaply, but they are getting that profit. So this is a delivery model, an example of a delivery model which was used under the market-based sanitation implementation approach, which was championed by the now closed, wound down USAID-funded Uganda Sanitation for Health activity. So you can see that they had a process of where, we're dealing with the sanitation promoters to activate demand. We are dealing with the masons to see that the delivery of these products is done. We train them, We link the two up. And then lastly, we make sure that there's financing. If someone cannot do it out of their pocket, they can have access to, all the finances to be able to move forward with this. So the creating of the appropriate loan products, we need to do that, and we need to talk to the banks to see, and the financial institutions, how we can be able to do that. But here I'm sharing something that came from a financial study in 2018, but it's still relevant to now. As we are looking at the financial services, we need to understand what the financial sector in Uganda is like. So very many people, this shows that very many people really do not have accounts, do not believe in banking. They believe in keeping their money in their in their what? Under their mattresses and things like that. Some people do not believe in borrowing. Some people have had bad experiences with the loan recovery and all that. How do you work with the financial institutions to get these people to know and to be more friendly, be as friendly when they are marketing, but tailor the financial products to this particular market, so that in future we do not have problems like people failing to pay for those loans? Otherwise, the financial sector people are not going to be able to do what? To give us those loans. Is there potential? People usually ask, is there potential for a market-based sanitation in this country? Yes, there is potential. This is a simulation of about 7 million households, a total population of 7 million households, where we saw that with the different levels of sanitation status that these houses were at, if we could move the people who were from the unimproved and then the limited to the basic, we have a big market which translates to almost 2 trillion Ugandan shillings. And this is only for a population of, 7.1 million, households, the population that we're looking at. But if you look at the entire country and you segment and say, if, for instance, one household can be able to afford 800,000 shillings under this sanitation market to have this toilet, what does that translate to? And these are the things that will attract the private sector to this market, this sanitation marketing. 2 trillion is out there to be grabbed. All we need to do is give them direction on how to be able to do this. The private sector will make its money, they will make their profits, but as in the development world and as the country, we will be getting our people to move up the sanitation ladder, which has a knock-on effect onto, improving the quality of life, getting people out of the poverty cycle, getting people to be more productive, and generally we shall have a country that will be what? That will be productive. So yes, there is a market. We only need to tap into it. So what do we need to do? Government has the power and the resources to intervene at all levels of this market. They need to define the rules. They need to look into the policies. They need to, when the policies say we need to meaningfully involve the private sector, have we talked to the private sector to ask them what do they think the government needs to do for them to be meaningfully involved in this? So we need to talk to them. We need to make sure that the enabling environment for the business is good. Other sectors have been seeing tax holidays and things like that, and supply chain and some backup and things. So what can the government do? There's something that they can do, but all they need to do is improve the enabling environment so that the businesses can thrive. When you improve the enabling environment, we are cutting down on the barriers that are limiting the enterprise and the sector. What do the funders need to do? Funders can have, they have a stronghold on giving giving direction and conditions on with the finances that we are bringing in. We would like to see some of it doing this. We are happy that the Sanitation Hygiene Fund, for instance, they stipulated and said, there are these good things that have taken place in this country. There's Finish Mondial, there's MBSIA, all these have been tried and tested. Can we now use those and scale them up because they have been tested to show? So the funders can be strong on that, so that their money that they're giving us, the agencies, is actually implementing issues, approaches that can get us the results that we really want to be able to achieve. So funders have a role to play there. What do the implementers have to do now? This includes the local, international NGOs and the local governments. We need to deliberately design and implement market-based interventions. CLTS has been great. CLTS has taken us to a certain level. What's next after CLTS? All of you have examples where you've gone and declared a village open defecation free. But the next year, when the rains come through, do we confidently go back and say that this village is still open defecation free? Yet our reports, we keep on doing the cumulative results. We say this year we had 15 villages declared open defecation free. Next quarter we have 10. Next quarter we have this many. So at the end of the year, we're saying we have 120 villages declared open defecation free. But because of the issues of looking at the approach, the implementation, the type of facilities and all that, we cannot say two years down the road that these villages are really open defecation free. So sanitation markets or a market-based sanitation approach can help us to see that these remain as open defecation free as possible, but making sure that we do those designs in market-based sanitation, we have strong presence, and make sure that we limit, we intervene on where to support the what? The private sector on seeing that the enabling environment is straight. We have it, we implement it, we fund it, and then we even learn from each other. One of the reasons for this session is to learn from each other. So hopefully we can be able to achieve something out of this. The enterprises, we need to facilitate them. We need them to appreciate where the business is. We need to show them that there is money in this. We need to support them, and they need to develop, test, what we have failed to borrow from the marketing world is, if you look at, for instance, Coca-Cola, or if you look at the Pepsi people, at a certain point, they tell you they have changed the housing of, we have redesigned the bottle. We have now changed the flavor to this and this. We have enhanced this. So the Coca-Cola or the Pepsi or the Mirinda that you used to drink in the 1980s in those funny whatever bottles, it's not packaged the same. So we need to learn that we need to put trends in our marketing so that we keep on innovating. And I think the Bill and Melinda Gates Foundation are trying to drive this. They have an innovation fund where they're getting private people and academia and all that to innovate about toilets, so that there's something fresh that is coming up. Just like you see cars, there are models, there are different models. But for us, you have this toilet, it has been the same. There's nothing that has changed, but good enough, some private people are coming in. So we need to support them in the innovations and all those things. So in this country, to support us to do all this, we have what we call the National Sanitation Marketing Guidelines, NSMG, that were launched. They were launched in one of the Sanitation Week. It was, I think, in Luca, it must have been 2021. This document is a document that we can use but adopt to our local context. It gives you all the different steps. So if you go to the Ministry of Health website, you'll find this document there. It gives us, it's the National Sanitation Marketing Guidelines for basic sanitation, but it gives us a step-by-step on how you can be able to implement. They have done a lot of this research. They have done a lot of these issues, the barriers, the motivators and the drivers, the enabling environment. All you need to do is read it, adopt it to your region, use some of the things that are there, and it is a very good guiding document. So as I end this presentation, this is something that going forward you need to look for. It's on the website, it's an open document, and it can give you, because it went through a whole process, a very rigorous market research process in order to come out with this. So it gives you pointers. All those segmentations that I was talking about are all in this. It was a rigorous process, like I've said. It was carried out widely all over the country, so it can give us good standing. But to give confidence to everyone, I know this is the part of the end. I just wanted to flash these few ones so that we know that market-based sanitation can work. It has worked in Cambodia, where people, instead of buying cheaper toilets, They waited for the toilet that they wanted that was fitting into their prestige, which was even more expensive, and they bought it. It worked in Cambodia. Why shouldn't it work? It worked in Peru. Why shouldn't it work in Uganda? The hygiene improvement project started something that worked in Tororo and the rest. Why can't it get? Because it got us to the first district to have open defecation, free sub-county in this country. It can. These are cases that we can build from. The water and sanitation program, I talked about it. There was branding. This tried to do something. We can learn from it. The water for people, they had sanitation as a business, which was implemented in Soroti, and it even had components of wash financing. It worked. So all these things can work for us. USHA, which was the Uganda Sanitation for Hygiene implementation project, which headlined the market-based sanitation implementation approach. It did great work in, proving a concept and getting people to actually buy and use toilets on their own, finish mondial. So this is to give you confidence that all that we want to achieve, we can achieve if we really, really put our minds to market-based sanitation implementation and deliberately have programming towards that, work with the government to see that the enabling environment is made well, get the private sector people on our side. Market-based sanitation sanitation will work, and it can certainly work in this country. Thank you very much.
In the physical setting, you'd have deserved a standing ovation or something like that. But thank you so much. That's much appreciated. Friends, now I want to open it up to 2-3 questions before we go to hearing, listen to someone from policy. Feel free to use your virtual hand or post your question in the chat window. Yes, we have a hand from Joseph Jimex.
Okay, Martin, I already put a question in the chat box. Maybe I wanted Dennis to again trying to highlight to us how we do market segmentation. I didn't get it quite well. Maybe we can also benefit from other people as well. Thank you.
Okay, I know that's something that he alluded to, but which particular clarity would you need, Joseph, under market segmentation? Do you need him to repeat the whole thing?
No. My interest was if you're doing a market analysis, maybe how do you segment population?
Okay,
yeah,
that's good. We have a hand from Jackson. Jackson.
Thank you very much, and I really appreciate the presentation. It was more detailed, but I want to be specific in terms of asking. It's just one question, and it goes to the facilitator. The most important question is, how do we ensure that the poorest and most vulnerable households are included in the market-based approach? And what measures can we take as CSOs to make sanitation products and services affordable for them?
Thank you so much for your question. I know that Dennis is taking note of all that. Let's get a question from Charles Opolot. Charles, your hand is up. Charles, unmute. Unmute and speak to us, Charles.
Yes, Chair, can you hear me?
Yes, please. You may proceed.
Yeah. Thanks a lot, Chair. And then it's a very great presentation. I have a lot, but because of the time, let me just bring just one, just share experience, or maybe just because I'm from the private sector. I was in Monta for some time, and I'm still in the private sector. Dennis, in your last conclusion presentation, you are making a recommendation. How do we have more engagement with the government and the private sector? But if you ask me really, let's invest a lot on the private sector. You gave a very statistics. I've been wondering, what have I been waiting? And you are saying we have about 7 million households if you look at the household alone. And I'm just looking at average, you are saying the investment is about 800,000. I was just doing some calculation that even if I do 20% of that household, as a private company, I would be making a fairly very good profit. If you look at New Vision or Monitor, where I'm coming, I came from, Monitor sells about 20,000, about 20 to 30,000 copies. Apparently, maybe about 15,000. But do you know how much Monitor makes as an organization? I think we need to have more engagement with the private sector more than even the government. How much do we need to interact? Like what Dennis you said, should you give a private company the angle and say this is what we'll be making? I think we'll have done a lot more than spending a lot with the government. Because with the government, we're only talking theories, but the action is zero. But the private sector, you discuss them today, the next 2 weeks, there's something that they will be planning. Just like me, myself, you will be surprised what I will be announcing in the next 1 month. Thanks a lot.
All right, thank you, Charles. Charles, just for you to know that I have someone from the ministry. Probably you'll have some react on that as well when the time comes. But yes, let me come back to you, Dennis. Dennis, kindly address these questions and then we can move on.
Okay. Thank you very much for all those who are appreciated, and I hope we have achieved something out of it. So, how do you segment a market? Of course, if you look at the document that I just told you to download, it gives a little bit of guidance. But in segmenting a market, first of all, you need to know who are the people, what's the population, where do they stand on the sanitation ladder, what are the things that are getting them not to get to the point where we want them. If they are at open defecation, what is stopping them from going to unimproved? If they're unimproved, what's stopping them from going to there? So you look at the barriers, you look at the motivators to get them there. So you look at socioeconomic, you know the socioeconomic factors. You ask them what if you're looking at an ideal sanitation facility, what does that ideal facility look like for them? How much are they willing to offer for it? But are they able to, get that money, ability? What do they do? How can they finance it? All these are different elements of segmenting that. Have they ever used, how far are they, for instance, from an urban setting? That gives you an implication of how deep the sanitation chain needs to go. Things like the loan financing. Do they really believe in borrowing for sanitation? Because this was something that used to be a trick for someone to say, I am borrowing 1 million shillings to go and construct a toilet. Do they think this is something that is viable? So you need to know where they are, but also most importantly, what they feel, what they think, what they want, and then so that those are the things that help us into the nitty-gritties of all this. So all those help in profiling an audience so that we understand where they stand, but what is their thinking about what we want them to do? What do they feel? Because when you talk about social behavior change, you need to go deep down there to get to the point of the insights that most times we miss when we're doing our development work. So even the marketing, it's informed by that kind of thing. I hope that can give a little bit, but please go to the Ministry of Health website, download that NSMG, and it will be able to give you a lot more guidance than what I can share in this short period of time. How do we include the poor and make sure that these products appeal to them? I usually want to say that poverty is relative, and I do not want to believe that people are too poor to get what they want. Remember, sanitation is a need. People need to use a toilet. People need to wash their hands. But do people want to? If you get the person, even that poor one, to wanting to have this product, then they're going to do everything else to get there. But nonetheless, with the products that we are putting in place, the different, just like you go into a market and you can get a shirt for 2,000 shillings, for 5,000 shillings, up to a shirt of 200,000 shillings. All of them are shirts. Their purpose is to clothe us, to cover our nakedness. But the difference is in the style and what someone feels when they're putting on a shirt of 5,000 vis-a-vis the shirt of 75,000 or the other. So the product lining, the variety, it needs to be able to fit within that provision. But also, the poor can be supported to improve gradually. They don't need to have this straight away at the same time. They can improve gradually. So in our implementation, we need to build in aspects of how do we get someone gradually from constructing a toilet. They do not need to buy some of the materials. If they have sand, they can mine their own sand. They can do their own bricks. You can cluster them in maybe 3-4 households. They can buy cement in kilograms. And these are some of the things when you talk about the private sector. How do you get the hardware store person in this locality to appreciate that they can sell, rather than selling a 50-kilogram bag of cement, they can actually sell 10 kilograms, and it will get them people buying. So all these are things that we need to build. So we're deliberate in making sure that no one is actually left behind. I hope that has been able to clear and give you some clarity on how the poor can be involved in this. Thank you.
Thank you so much, Dennis. Let me take the last hand from Paul. Paul, please, you may come in.
Thank you very much. Yes, I want to thank Dennis so much for making such an impressive presentation. The concern I have with Dennis' presentation, the presentation is so good. The slides were many, and I think he was tempted to move faster than some of us to catch up. Otherwise, the presentation was very good, but he was so fast, and we missed some of the important areas. Comment is that he talked about while he was defining sanitation marketing approaches, and somewhere he commercial marketing techniques to apply or to achieve change, which I thought was very important. But here, for instance, if somebody wants, he may give you a tube together with a brush so that you can be more easy. You find that it is a very good one. Buy one and get two.
Paul, you're breaking.
Sorry?
Paul, you're breaking. If you could just repeat your submission, please. You're not so clear. Paul?
Approach, and it's very difficult to use only one approach like national marketing. You want to go. Faceted approach. Sanitation marketing is very good, but also home improvement campaign is also very good because it looks at a home from a. So I think as we apply the sanitation marketing town or other approach, for example, reinforcement also has this advantage. Otherwise, I think Dennis is a.
Okay,
thank you once again. Good presentation.
All right, thank you, Paul. Paul, you aren't so clear,
Thank
but
that's my observation.
What I could have picked is that you're calling for an integrated sort of approach, combining MBSI, combining MBS with other approaches to make it work. That's something that I'm picking from you.
Yes, not to pour cold water on other approaches because they have also unique advantages.
All right. Maybe Dennis will comment on that. I'm seeing so many other hands, but colleagues, feel free to post your question in the chat window. We would like now to move on to the other section, but we shall come back to your questions or rather clarity, and I'll make sure that they are addressed by Dennis or any other speaker. So at this point, allow me now to invite a public health specialist from Ministry of Water and Environment, and that is Martin Mukasa, who will be talking to us about the role of policy frameworks and different regulatory frameworks and, of course, institutional partnerships in enabling the growth of market-based sanitation markets. Basically, we want you, Martin, to talk to us about how the different policies are aligned and how they enable the growth of market-based sanitation markets. Thank you so much. And Martin, you may come in now.
Thank you. Good morning, good afternoon, team. It's 10 minutes past midday. I'm happy to be here with you and joining for the first time. I'm seeing a number of people that I know and have been in the sector. Nice to meet all of you. Dennis, please help me and share your slide on the policies. I don't need to upload a new PowerPoint. Dennis, Alioni? Well, is it still on? Okay, okay, before I go into breaking down some of those policies, and I would like to first comment on what Charles presented. Was it Charles Opola? Yes, Charles presented. Yes. As government, we are very supportive of the approach of market-based sanitation, and we create the environment within which it thrives. And that said, it takes us straight to what we need to know. Where do we come from, and where are all these things coming from? When you look at the Constitution, Public Act, as amended 2021, the issues that tell us about what we must have as a responsibility of citizen, and also, but it doesn't describe the procedure of how to get there. Now, we're going to have other policies like national environmental policy, Cabra, the declaration on sanitation. They all talk about what we must have, not the process. Now, when we go to the each strategy, it tells you what we should do and and a bit of how we should do it, but doesn't give you a one-off, like Paul's Luma had stated here, that we need to have an integration of various approaches. How can you integrate MBS in home improvement the campaign? We might have a home improvement campaign, but in particular to improve certain the components in that system, we are forced to have market-based sanitation because home we need to invest. Our law demands us to have some infrastructure, but doesn't finance it. It says it's the responsibility of the household or the author to provide the service. The case in point, household toilets are supposed to be provided by the household. So they should invest in the capital component of it. And we have all heard that the income levels are not the same. So how do we play around with Mukasa who has less money, Mukasa who has more money, and Mukasa who has sufficient money? We don't like the same products. We all go to work in different ways, and we find that others drive a Benz or a V8, others drive a Wish, others drive a Harrier, like that. So, but the sanitation comes in to address the issue of what products are people willing to buy. So, when we are designing a project, we need to look at what are my customers going to buy, not what I want them to have. Sorry for that. I have some bit of cold. Going ahead from where I stopped, when we're designing market-based sanitation, we have to look within the policy guidelines. What are the basic standards? Now, basic standards have been incorporated in the National Environmental Act. This time around, I think has been reviewed last year, supposed to be launched this year. It has standards of basic minimum, because when we say we're going to have someone using cut method on the sanitation in London. Yes, it's better than going in the water or on the ground bare, but is that sufficient? But how do we ensure that Mukasa, who is still using the bush, buys at least a basic toilet? We have to pitch it. And how do we pitch it? We do create demand for that service, that Mukasa should be able to be attracted to this facility. We create demand. How do we understand Mukasa is intending to be a politician? How do we make Mukasa understand that him lacking a toilet is a no-go zone for any politician? So we go to Kampala, the declaration. The bullet number 1, I think Paul was my assistant commissioner by then in EHD, or just before there. It says exemplary leadership. Now, that is a demand question bullet in KDS. It talks about how we live exemplary lives as leaders. And it goes ahead to enforce, to try to point out that all points of administration, our officers should have infrastructure relating to what we intend to promote out there. Those days, those were already mature enough to visit some places. Some countries will go there and they don't have toilets. Some counties, some schools, some health centers, LOCs, they didn't have such infrastructure, but they are our leaders. So you can see how MBS is coming in to reinforce KDS, exemplary leadership. A leader would love a toilet, which is looking attractive. I'll give you an example. The higher you go in offices, some of you and some of you are EDs in some of the NGOs. You know that your office has a toilet inside there. Because toilet is a prestige product at that level. It has some bit of ego and the status in society. So how do we create demand? We show that it improves our status. So renouncing our ego of having high status, we automatically go for waterborne toilets inside our office or inside our bedroom. So that serves our ego. So that is part of reinforcing the existing policies. When we go into the supply chain improvement, we have had yes, in water it has never been there, but we've never had it. But yes, it is still existing at higher levels. A case in the point, when you used to not have VAT on wash inputs, that's like 5-10 years ago. That was supply chain improvement. We lowered the taxation on those inputs so that they become relatively available as government. That was a supply chain improvement. Expanding, allowing the open market economy where people can then compete. If government insists that all structures shall be built by companies, not individuals, because today Mukasa, who is a mason in his village, is called an engineer, and you can't take that away from him because he has built so many of our houses, and nobody stops him to please, where is your trading license? There's community know that he's a good builder and he can do the work. They give the work. We don't follow up to say before you build, you have a certificate in the BCP. It's very good to have one, but industrial people are building with industrial knowledge. So we are benefiting from that because we are not insisting, we are not over the regulatory. When it comes to down the chain, when you're buying equipment for empty, government has a way you can report those equipment with some taxes waived off, because that's how many of our partners who buy that equipment, we hand it over to the utilities, are able to buy those equipment because we write to URA to inform them that that equipment is coming for this and this, and is supposed to support the services. And the MBS doesn't work only at containment; it works across the whole chain. A case in point: how do you convince a market emptier to go to gulping. And how do you, because if the bucket emptier, in Uganda we call them vachura, they work at night, it's a disgusting job. But if you show him that he can still empty, make money without touching the fecal matter, you're selling a product to a bucket emptier to adopt a safer emptying approach. And after some time, a household which is complaining that these bucket emptiers are emptying and leaving my compound dirty and smelling, you can pitch you can pitch a vacuum truck or a gulper to do a service and show them how they leave the place less messed up and less damage to their infrastructure. That creates a very big avenue of delivering this service. And now government has through partners like other lower governments like KCCA. KCCA is a very big player now because in the Kampala Declaration on the Kampala Sanitation and the Solid Waste Ordinance, they officially recognize Gulfers because Gulfers didn't have anywhere they were in the books of any local government. So in that process, we are creating room for a new product. We are gazetting it because them are delayed them licenses. But now they can go to them and say, yes, we are under this year we are gazetted and we are working in Kampala metropolitan area. So our tool is acceptable. So such opportunities are there to enhance the markets because many people fear to get trucks to their home. One, the road access is not there, but also the cost of the service is quite higher than what many households can afford. So in trying to bridge that gap, if Mukasa can imagine a galper who is cycling at the same cost with the bucket empty or slightly cheaper, then I'm in business. We have heard about bucket empty. I mean, gulpers who come and do the reef empty. It's a form of address of having a product which suits Islam. Our toilet is full, but we have only 25,000. Though the toilet has 20 barrels to be filled. I'd rather call a gulper to pick one barrel from my toilet and I use it for the next 2 weeks or a month as I collect for more money to empty it completely. Those are all government efforts. Now, overall, when this time is more specific than NDP. NDP3 was a bit challenging, but now we are sure that environment capital the program, all those indicators of WASH, how are we going to achieve them? We have to get something kickstart to move faster. So government is using other policies like private-public partnerships. This is a very good approach because it saves us from government doing all the business. There was a study done by World Bank like 8 to 10 years ago about cesspool trucks being given to local governments. We discovered that if a cesspool truck had a lifespan of 10 years, 60% of that time it never worked. Why? Government employees are supposed to work between 8 and 5. But pit emptying in our social environment happens at night or very early in the morning. So that meant that the time the truck is required at households, the service providers are not yet at work. So that meant we miss an opportunity. So private sector engagement in providing this last mile service makes it more flexible, very flexible. When you call a cesspool emptier that Can you empty? He can come at 6 p.m. when you're from work, empties, goes away. He keeps the tank full. In the morning at 7, he's driving to the disposal site to dump. And it saves him from driving through the traffic jam of 8 to 5. Between that time, he's so busy. So you can't drive through the traffic jam. When you look at the National Sanitation Marketing Guidelines, as the Dennis has admitted to it, they are very specific. As he talked about customer-centered products, best fit products. Now, these products might not fit within the Public Act. You know, when the time I was still a student, they told us the toilet should be 15 feet deep. So how does a man who stay in Lubiji or next to Lubiji have a 15 feet deep pit latrine if at all he's having an on-site sanitation system? It becomes a bit difficult. When it comes to the component of improvements, if you can build a line pit latrine today, and in process using market-based sanitation, you improve it to waterborne in the house, it makes it easier for you to move up the ladder than when we say we're using this casting stone. Markets allow improvement, but we focus on the strategic investments. Actually, market-based sanitation, the one we have been exposed to, is focused on strategic investment. Like if you're looking at on-site sanitation, we try to focus a lot on the containment, the base. How do you make it stable? Dennis, he talked about the shortcomings of CLTS. Yes, we normally get ODF. After 6 months, we have the ODF still after one tsunami. Oh, we don't have a tsunami in Uganda, but one torrential rain. So most of our toilets, yes, we had them, and they are broken. Despite the fact we understood the theory of CLTS, shame and they discussed, we have an option. If we are 3 neighbors and all of us, ours were washed down, I'll share with you. In the villages, a neighbor is 1 kilometer away or more. How are we going to manage that? So those are things why we need to adopt market-based sanitation. Policy-wise, I think when we look at KDS and ISH, those two are very specific because they are giving us what we need to do. How do we create demand for the toilet? Sometimes we say the law, we as health inspectors, we normally say, let's check them on, charge them. How many are going to put in prison which don't have toilets also, which are insufficient? They might have some, but are they sufficient? Is that enough? I remember when I was still a student, they told us defining a toilet which is almost full doesn't give you a right to break it down, because despite the toilet being full, you break it down, you make them go away from a place where they collect their fecal matter to go back to open defecation automatically all over the compound. So sometimes the component of coercive enforcement has failed to work. How do we ensure that people buy a product? Because they're going to use their money. Okay, if you took me to a judge and tell him, judge, I didn't have food at my house, I would not invest in a toilet. What is the record that you will win that case? The case is almost lost on the humanitarian ground. But the same person who says doesn't have money to buy food, he has airtime on the phone. How did the networks make it next to impossible? You should have airtime. We began by paying service fee. Now we don't pay service fee, and now we buy call bundles which call across all networks. They are trying to make sure that we keep communicating on their system and not allowing us to fall off. That is quite interesting. So how do we make people buy our toilets? We should understand NDP4, KDS, and there were 10 points, I think, under the KDS. Then there is strategy. When we come to promotion, promotion, enabling environment, emphasis promotion of social marketing approaches. Now, government of Uganda has put up a lot. Is I think we have one, apart from the bad implementation of some of these policies, the enabling environment is very good. We have human resource across who can support technical human resource. The challenge is we have a lot of bottlenecks at the point of service, that is the law government. We have health inspector sitting next to the DEO and the police. So if I have an issue at school, I can't go to the district court or to the sub-county because the CDO, where I had a case of GVB is next to the health inspector who is supposed to guide me on what to do. So how do we bring this health inspector or health assistant from his comfort of the office to engage as the CSOs who are working down there? How do we get them out of the comfort of office to come and share? Or how do we work with our teams that we hire to engage objectively? We have a VHT policy which allows us to use local resource persons to market. So those local resource, the person are available to all of us who are active in water, sanitation, and health. We need to pick on them and others who are available to reach out with our product, the product for that area, or a product for. We can all be staying in our village of Mutungo, but my taste of a toilet is different from the taste of Martin and another person. We all have different tastes. So the product is designed for a household, not for the village. We have a picture of the village, but at a household level, we have Swiss products. With that said, I don't want to go around because these policies are known to so many of us, but we need to get how to input Kampala Declaration of Sanitation into NDP4, NDP3. This transition is going to be very good. The way we jump onto it with this at the back of our mind, we shall have a lot to deliver. I think I've shared with you what I could offhand. I used the Dennis slide. Dennis, thank you so much because it was very summative in nature. Thank you. Thank you, Martin. Thank you.
All right. Thank you. In the chat, we have a question from Simon Mukume, who was asking to know what would be the minimum cost based on your experience. I think this was a question going to Dennis. And again, Umar Masereka, you have your hand up. You can also make your question known, and then we shall have the speakers respond before you can go into experience sharing from some of the people that have actually implemented this concept. They'll be sharing with us how this is faring wherever they're actually doing it. So just keep around and let's get the speakers respond to those two questions. Then I'll come back with someone who will be sharing with us some of the experiences they've had. Dennis, I want to come to you with this question. What would be the minimum cost based on your experience? If you could just respond to that, and then Umar, you'll also make your question known. Okay, as Dennis comes in, let's hear from Stephen William Iliru.
Hello.
Stephen?
Yes.
Stephen, you may proceed.
Yes, good afternoon, colleagues. Thank you so much for the nice presentation. And I would like to appreciate all the presenters. However, the first presenter hinted very critical issues, especially how these indicators of our sanitation were measured 1935, 64 until 2000, then everything stagnated. for me, I would want first to go back to us. How sustainable are our services? Because this was one of the questions that was asked in the Stockholm Water Week 2017, when they were discussing about WASH. And it comes back to us. How sustainable are they? Because when you look at the issues we are grappling with, are basically interdependent on the others. For example, when you look at straight to the Ministry of Health and look at the number of VHTs they are involving, do they have the pit latrines? And these are the persons who are directly working with the populations, and they are regarded as the first-class hospital in the community, and they are also respected, and they collect data quarterly on hygiene and sanitation, but they don't have these facilities. So how sustainable are we when we are dealing with such persons? We also look at the issue of the public health enforcement. We have these people everywhere, but I don't know what they are doing, but you find them, they're in every district, they're in every sub-county, but the people are occupying houses without pit latrines, but the only active department is the revenue because they want ground rent, and they are picking and they don't ask whether you have a pit latrine or what. So I think the problem is within the system. The government has also failed because for us NGOs, our work is carrot. When we fail is when we give them to take the stick. But you find that these people are there and there is nothing being done. We also have government programs. I appreciate the one of CDD, which looked at hygiene and sanitation, immunization, education, before somebody qualifies to benefit for any item. It looked at a group, not an individual. If 80% of you score, you are qualified for the community-driven development funds. And these are kind of initiatives that can help us leverage our hygiene and sanitation in communities and households. Because when we just leave it like that, we will find that everyone is there. Then I think in the 21st century, a lot of issues on human rights came in. Everything they are talking about human rights. But even sanitation is a human right. Why are we not emphasizing it as a human right, that you have a right to have a pit latrine, a decent latrine, but they only say you are violating human rights. If somebody is arrested, you are violating. But also they are violating other people's rights. So I think a lot of rights have come in to overshadow the useful thinking that was evident in those days of the 90s. And then the last one is the forgotten private sector. For me, I feel the private sector has just been forgotten by the government because that is the driver of hygiene and sanitation and any development in any country. If you leave the private sector, then we cannot do it alone. But we needed somebody who can initiate the idea and train others and involve and evoke that feeling of ownership of an item. Because once somebody buys something, he has more privilege to own it than when it's given for free. I would like to end here and over to you, Martin.
In that, Umar, you had your hand up. If you could please pass on your question.
Yes, thank you very much, moderator. I don't know if it's a question, but because I'll drop out after I've made my comment. It's a combination of Dennis's presentation, Paulo Lima's question, and finally the one of Minister of Water by Martins. Umar Masereka was part of the USHA group. In fact, this specific part of the crafters that this one being called market-based sanitation implementation approach. Crafters, I mean the idea behind it being given that name, and implemented it. Probably got over 800 households to basic sanitation. Talking about basic sanitation. So I'm talking from that ground, and that as using the Mbisha just small experience. I know it has another topic somewhere else, but I will answer Paulo Lima's question of where does this approach connect with the other pieces. Members, I want us to agree as we listen to this webinar, the difference between market-based sanitation and the one of Mbisha. There's a bigger market-based sanitation that everybody is grappling with. That one is the bigger one. But probably, I don't know that I got the heading of this webinar as if it had its focus on market-based sanitation implementation approach. This very one is the one that the Mbisha project implemented. So to go back to Paulo Lima's question, the reason we got the very big numbers in around three years only, very big, over 1,000 households converted to basic sanitation. There are only 4 tenants, four strong points in this approach. The one of Mbisha, not the other bigger one, the one of probably Cambodia and any other place. The one of Mbisha, Mr. Paulo Lima, who is our senior, has one very strong factor. It mixes CLOTS with the market-based sanitation and some bit of campaign. The three somehow take place in the same space. I repeat that the one of Mbisha is a mix. It has its background in the CLOTS approach. It picks some bit of strength there. It mixes it with some bit of campaign, and mixes it with the market-based sanitation, more especially talking about the supply chain. And it has 4 tenets. One is collective action. What happens is that you are not selling to a household. You are not taking a product to a household. No, that's not what we do. We collect people together, and what happens is there's what they call collective action, which was picked from CLOTS. Collective action means the rich people will construct the latrines first. The poor people may construct basic latrines in 2 years. You don't sell at one time. But the principle that everybody in this village will have a basic latrine is what is upheld. We all uphold that all of us shall go to basic sanitation. That answers the other question of somebody who talked about vulnerability. No, we don't give subsidy. It's a question of time. It's a question of time. For those who are rich on this webinar, they can construct the latrines in 3-4 months. That's what we saw. For those who are poor, who collect the materials as time goes, they can take a year or even 2 years, as long as it makes them get their latrine. So there's no subsidy because we are not time bound. Given time, everybody on this earth, as long as you are breathing and therefore defecating, can get to a basic sanitation. So collective action is one of them. The second one, quickly to even save time, is the pitching, the household pitching. The household pitching, Mr. Lima, is similar to our normal household visit by VHTs. But for it, it's a real pitch. Pitch, I must sell to you a latrine. I must sell. How I sell is another story. The third one is the demand activation in the middle there. As you pitch, the way you now follow up this person to make sure that finally he starts investing in a latrine. And then the fourth one is strengthening the supply chain, where we need the private sector now. The private sector now comes into the fourth tenet of the supply chain. So this is the market-based sanitation, but it borrows pieces from other approaches like CLOTS, like I said, some bit of a campaign, and then finally, say, supply chain strengthening. So that I was struggling to answer Paulo Lima's question that it borrows its operations from other approaches. In other words, not a standalone. The last one is about Martin's submission, which was generally very good. Before Usha left, we left only 2 things with the government of Uganda. One, we left them with the market-based sanitation strategy, the one my brother Dennis presented or talked about. We also left them having changed the guideline. When they are sending money to districts, the one for sanitation and hygiene, the hygiene piece of the fund was guided that, guys, you can go your campaign, but all of us want to go market-based sanitation. Besides, like everybody has said, sanitation, basic sanitation is an SDG issue, 6.2. We can't get it. So in terms of policy framework, I think internationally and nationally, we have what it takes really to take the whole of this country to basic sanitation. Probably what they lack is enforcement. I think Martin mentioned it, and all of us have to take it. What they lack, what the Ministry of Water and Environment lacks, they just send the guideline, and then people read. To decide to take it up is another war. But of course, I think because the man is also little, and because of the very many practices. Number three among the stakeholders are the players on this call. Probably, guys, now that there are three policy directions, one is SDG, which is global. The second one is the strategy, which guides the details. The third one is the how to do even MISIA itself. I think we have enough policy framework, ladies and gentlemen, more especially the partners with some bit of money. Please, 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 I beg that we invest in basic sanitation. Nobody can answer. I'm waiting for Dennis to answer the question of how it costs. No, from this year, no. You can't give that answer. You cannot cost you cannot have a real cost of a latrine under the MBCA model, no. You just have estimates. Because you allow people to collect their materials depending on what they can afford. So it's difficult to really quantify because we don't sell a latrine as a whole product. We can sell it in pieces. Of course, Dennis can give a guide on what costs by latrine, but I think the answer is complex because it's a whole journey. So there's no cost, the cost is zero. Or the cost is 4 million. A poor person can take 2 years investing 4 million in a latrine. People have done it everywhere. So the issue of the cost is not, if you cram the cost, you'll be missing somehow the point. You can move a whole journey of 2 years and have your product, whatever it takes. So briefly, that's what I wanted to say because I will disappear. I will not be part of the other people who will be sharing experiences, but it was a wonderful experience of 4 years. We learned and learned and learned, and now we are sure the model is being scaled up. Water Mission is doing it, other districts are doing it, other partners have picked it. So wow, the MBCA model, not market-based sanitation, the MBCA one, the MBSI, which has CLOTS in it, they don't have described, is probably what we think may somehow change this world. Of course, that's not downplay the other approaches that we've been using. They have taken us some distance, but once, if you add in the other pieces, like I said, collective action, the pitching, the demand activation, and work on the supply chain, I am sure everybody in this country, rich, poor, disabled, will have a basic latrine. Thank you very much, members. Thank you for listening.
Thank you so much, Umar. Umar, before you go, thank you so much. I mean, that offers some more clarity and to the question that were raised earlier, but also some more into the discussion that we're having. I just wanted you to kindly speak to the role of CSOs here. I know that you've talked about the different ways through which can have this done, the pitching and all that. Kindly talk to us on how these CSOs can again come in to support the scaling up of this year. Umar, please, before you go, share with us that experience.
Perfect, Chair, perfect. Just like I said, I worked in the Eastern. How did the Water Mission stop totally? Water Mission stopped using their old approaches and made new proposals to fund this one. I don't know if there's anybody from Water Mission from here because they would give us the best example. One thing, thank you very much for the question, because apart from the policy framework that I talked about and what Martin mentioned, if the CSOs, if the private sector, if the NGOs in UWASNET, honestly, they don't come in, we shall not change much. How can they come in? One, we have enough documentation. Documentation means the Ministry of Water, these Martins and the Marthas and everybody has enough documentation. The strategy itself and the very, very many guides. They are not cast in stone. You can change them. What we are doing there was American funded, so it had all the money. But you can change them and just play around with them to make sure that you do it very well. So I don't know how I answer the question. Two, the districts where USHA worked, for example, have trained personnel so that the NGO will not be meeting the high costs of training, the very many trainings, they will be picking from there. And then the funding. So I don't know how I answer the question, but overall, we are banking on the CSOs, we are banking on the NGOs in the waste sector to just go to the local governments. to just go to the ministry, which has every tool. I repeat, they have all the documents, they have all the guide. Finally, we still have, fortunately, we still have the likes of Dennis, the likes of Umar, the likes of Stephen, who are still available. They tried the other model. They saw it work and work cheaply. People normally fear that the cost is very high. You can manipulate it. Bottom line is to make sure that people have what? Basic sanitation. You may not necessarily have to borrow, go the Usha way, which was American. We had a lot of money around us. You may not take that direction. Just get the principles. You'll get these things cheaply. So I don't know that I'm responding to the question, moderator, but I'm saying the way to go is this private sector, the Ministry of Water, and all of us here we are available and have the capacity to support you to make sure that you run with this animal and make sure that people get real basic sanitation for sustainability and for real health outcomes. The good outcomes can only come through basic sanitation. Sorry, I may not have answered the question well, but that is it. Thank you.
Yes, thank you so much. That really answered the question, and it really gives us the right direction on how to start and where to go. Thank you so much indeed. Friends, allow me, as we get to the conclusion of this webinar, bring in Stephen Birungi, who is one of the share with us some of the experiences. But maybe, Stephen, before you come in, I'm again seeing Umar's hand up. Umar, was the mistake? All right. All right, Stephen, you may now come in and please share with us your experience on what you've been able to pick as implementing this approach.
Okay, yeah, thanks so much, Martin. Greetings to everyone. Thank you for the opportunity to share with you some of the experiences working with the market-based approach for sanitation. In the first place, I would like to agree with the previous presenters, especially with I think it was Dennis, who presented to us the implementation approach for MBS. I would like to agree with him that from experience, over time, organizations and other sector actors, government and other stakeholders have invested in sanitation promotion in different areas. But 5 years, and sometimes they gain so much successes and declare villages, ODF, and celebrate and what have you. But I would like to agree that when you come back 5 years down the road after the project has ended, you ask yourself whether any investment in sanitation had occurred in that area. But from my experience and the experience of the organization I work with, which is Caritas, and in partnership with Mondial, I do agree that I have realized a significant change in terms of sustaining the gains achieved under the market-based approaches and the market-based sanitation. The gains achieved are really sustainable in that if you come back 5 years or more after the project has ended, you will be able to find serious the facilities that were constructed during that time. And the major reason is that the market-based approach incorporates key aspects, especially in terms of addressing the supply chain, because the previous solutions were only addressing the demand side. Demand was being created amongst the people, but at the end of the day, the demand was never addressed. So households would on their own embark on construction, and then at the end of the day, they construct things that do not meet the standards and they are not sustainable. But the integration of the supply side into sanitation was a very key aspect in making sure that sustainability is attained. So with the years that I have participated in sanitation promotion using MBS, I have realized that there is a lot of sustainability in as far as the gains achieved. Number two is that we have looked at the exemplary leadership approach integrated in MBS. The leaders have actually come up and embraced this. They are interested in having latrines that meet their standards or meet their status as leaders of the community. And once we engage them from them, because we are lucky that maybe we are lucky as Uganda, we really have a very huge structure in terms of leadership from the district. Go to the sub-counties, to the town councils, to the parish level, to the villages. There are all levels of leadership structures, and all these have both the technical and political leaders. So in terms of numbers, you can achieve very directly towards in terms of numbers if you focused on leaders. And for them, you just show them that they need to be examples of the others, but also they are also interested in having latrines that meet their standards. Then there is also the aspect of clustering, and this addresses the financing aspect in as far as MBS is concerned, whereby not everyone may have savings on their own to invest in sanitation, but also not everyone qualifies or can straight away access financial institutions such as banks and SACCOs and other microfinance institutions to attain loans for sanitation investment. But under the clustering approach, you are able to bring on board several households, let them form a cluster, and therein, on a merry-go-round aspect, they are able to finance a sanitation facility for each of the members. If at all a cluster has 10 members, on a month, each of these can finance a latrine for one member, and at the end of 10 months, you are able to have 10 sanitation facilities. This has worked both in the western part of the country and in the northern areas of this country, where we have really gained such a significant aspect. The other experience has been in line with the business, that there was pitching of sanitation, of the business in sanitation, and specifically to the Masons. They realized that there is a business in there. And because of this, we have realized significant strides in breaking down the barriers towards gender issues, whereby construction was known to be an aspect or an area where only men would venture in. But in the districts of Nyangavu, Kabarole, and Kamwenge, we have seen women break this barrier or break this norm, and are actively involving themselves in constructing latrines and are earning big from this. We have women who have shared with us their stories. Some of them are widows, others are young women who have just their youth and now are earning big from construction of sanitation facilities at a fee. They have been able to take their children to school. They have been able to meet their bills in terms of health. They have been able to feed themselves and also their families. Basically, they have grown and also had some money to invest in, for example, the houses where they live in, and also other key areas of their life. So in that, because there is business in here, they have gone ahead to do the marketing for themselves. And this gives us strength and courage that even after the project ends, these businesses are able to continue marketing sanitation at household level, because for them, that is their business. And because of that, we are able to see that scale in terms of sanitation attainment at household level will always be attained. The other thing is related to pimping the latrines, and it aligns very well with the previous presenters, whereby they mentioned that different people have different preferences and different interests in having a toilet. There are different features, there are different needs and different wants in terms of how they want their latrine to use. So there is this thing called pimping a latrine, whereby we have seen people who have gone an extra mile to add extra features on their latrines in terms of painting, in terms of pictures. There is one of the latrines in Bunyangavu where someone even put a solar light in there, put something like a radar on the toilet, but all that shows that this person is proud of his facility. And once that is done, the other households can look up to him and also end up adopting safe sanitation. So the issue of integrating the supply side into the sanitation aspect as strengthened under the MBS approach really shows that people understand or know that this latrine has real has strong importance in terms of their lives, other than saying, let me just construct because it has been a law, government has told me to do that. But there is that preference, just like you go out and say, I want to buy a shirt. On that shirt, there should be a logo for Arsenal or a logo for United or a logo for this. So I want to buy a phone, but this phone, it should either be an iPhone or it should either be Samsung, it should have a radio, internet, and the others. So in terms of sanitation systems, I think that is the direction we are taking. And if we do that, we shall find that households are investing in sanitation facilities with as much ease as there can be compared to the previous times. Under the Sanitation and Hygiene Fund, we are now at a stage of setting up the system whereby we have all the key stakeholders set. We have the side of entrepreneurs, the hardware stores, the masons, and the others trained and in place. We have a catalog that provides the different types of sanitation systems from which households can choose from. We have engaged government officials whom we are working with to create demand. We have identified financial institutions and the others to work with. So basically, this period has been more or less on setting up the system, and then we have just started now the aspect of triggering, which of course has been preceded by the household listing, which is supporting us with the market segmentation and others. So in the next 6 months, we look forward to the surge in terms of adoption of sanitation systems and of course different technologies because of the different preferences and the needs of the households. But I must also mention that as we talk, already people have started constructing, and they are constructing basic sanitation. With the trained masons, we have also been able to see a lot of upgrades from upgrades to basic sanitation. Yeah, so that is it that I can share. Back to you, Martin. Thank you.
Lovely. Thank you so much, Stephen, for sharing your experience. And I think as we depart out of this meeting, I guess we all agree that this is an approach that can really work and can really shift us from where we are to basic sanitation as a country, but also propel us to realizing Agenda SDG 6.2 as of 2030. Allow me at this moment, of course, mention that access to basic sanitation for us as a country will not only impact at the micro level, but also if you look at how much the government would invest in the disease burden, it would certainly affect so much at the macro level as well, and the development of the national development of this country. So I think I wanted to really point out that, but also do appreciate our speakers of the day. It's been Dennis Alioni, MBS specialist, but also the speaker from Ministry of Water and Environment, Martin. Thank you so much. Allow me also to appreciate you, the participants in this webinar. You've really had, you've made it more interactive, and thank you so much. for the questions. To Umar, thank you for your additions, but also to every other person who's been able to join this conversation. I know that we're not leaving this place as people have just had a conversation, but certainly we should be able to make a difference from wherever we're coming from by either, preaching this gospel, funding the approach, calling for finances towards this approach, going for, behavior change in our communities, but also being able to pass on the knowledge. So thank you so much indeed. And from us at UWASNET here, it's really a good afternoon to you all, and have a good day ahead of you. Thank you so much.
Thank you.
Thank you, Martin. Thank you all. Bye-bye.